I test thousands of patients for heavy metal toxicity. Lead is by far the most predominant heavy metal that I see on tests. Matter of fact, you can click below on the link below me and actually get a good view of this test. But this is a typical test that we use for heavy metals. That dark line that you see going off the chart, that's lead. And again, I see that more with lead than any other heavy metal. I would say second would absolutely be the one below it, which would be mercury. The proper test to do, and this is probably what I see wrong most often, is people get the wrong test done for heavy metals. And I spoke about this a little bit on mercury, so if you haven't seen the mercury portion of this, you might want to watch it. But most people do a blood test for heavy metals, and that's great for an acute exposure, but it does nothing to look at chronic exposure. And I can tell you right now, lead is most often a chronic exposure. Where do we get most of our lead exposures today? Because before 1978, of course, lead was in everything. It was in gasoline, meaning it was in our air. It was in the paints that we used, practically in most household items. So I grew up in the lead generation. Of course, my parents grew up in the lead generation. But where are we getting most of our exposures today? If you watch CNN or Fox News or any of the news stations, you've probably seen a lot on lead coming from in toys in China, which is still in the paints. Even herbal products, some of those things can have lead in them. Even dishes, painted dishes. So there's still a lot of places that we can get lead, but most of the lead exposure, when I see a test look like that, most of it is from mom. Our parents are our number one source. So when I see, like in this case, mom's level of lead is high, in this particular case, all the children also had high lead. So our number one exposure is mom, unfortunately. But also, we can still get lead. If you're living in a house built before 1978, the dust that is in and around the house, all of it contains lead. If you were in a house that was remodeled, that was built before 1978, and you were in the house during the remodeling, I can guarantee you your lead levels will be high. Look, most of the lead is stored in the bone. This is why it is very difficult to get out of people, and it has to be done correctly. I can't tell you, and I said this for mercury, and it's the same with lead. Most people detox heavy metals incorrectly. This is one of the things that changed my life, being mercury poisoned. But lead also plays a picture in mercury poisoning as well. Lead and mercury and other metals, they work synergistically together. If you have an elevated lead like this one, and then you get a vaccination, a flu shot that contains mercury, or you get an amalgam filling drilled out, now you're in big trouble because these metals have a synergistic effect, which means the symptoms will be much greater. The symptoms not only will be greater, but the disease potential will also be much greater. Look, we have a correct protocol in dealing with lead. There's 2 times in life when lead exposures, I feel, become the most problematic, and that is number 1, at pregnancy. Why? Because you lose bone during pregnancy. With the bone, out comes the lead. So when I have a patient comes in and they say, gosh, I was normal, doc, until after my pregnancy, and then all these symptoms started, one of the first things I consider is lead. Also, as we age, we lose bone. Again, out from the bone comes the lead. So when you look at lead toxicity, you have to understand it's typically chronic. Most often it's tested incorrectly, and always it's seemed to be detoxed incorrectly. So please look for the correct testing and the options that we use for detoxification. You have to do it the right way. It'll save your life.